welcome back. Let's continue. Okay, so we've learned how to observe the signs and symptoms in the eye in those with schizophrenia, and also even how to investigate that further. But how do we treat it, or at least slow the progression of such symptoms and signs? And the answer to that is probably similar to many medical conditions, which is to treat the underlying cause. Actually, with the antipsychotics, which is used to treat schizophrenia, is also found to have diminishing effect on the ophthalmic symptoms. However, we should also be aware of the effects of psychiatric medications on the eye. For example, chlorpromazine, which is a typical antipsychotic marketed sometimes under the brand names Thorazine and Largactil. This can cause cataractous change in the lens. This means that as the light goes through the lens, instead of having a uniform index, it causes the light to scatter and not converge neatly on the retina. The other medications can cause transient blurred vision, mydriasis or pupil dilation, and also blepharospasm, which is the spasm and the excess tightening of the eyelid muscles. Some can even cause pigmentary retinopathy, which is a proliferation of the retinal pigmental epithelial cells in the retina, and that can cause degenerative retinopathy, which is very harmful to maintaining sight. Unfortunately, the prognosis of the eyes during schizophrenia has not been well studied. The patients are not aware of the link between schizophrenia and the eyes, and because this is not well studied, and they tend to not regularly obtain ocular exams. It is also important to note that schizophrenia is not a curable disease. And overall, I'd say the prognosis would be adequate and pretty good when managing schizophrenic symptoms appropriately. This is also important for the patient's overall quality of life and ophthalmic health. It would also help a lot for the patient if they have regular eye checkups with their general practitioner. We have covered a lot in this presentation, but the main message is to establish a link and inform of this link between schizophrenia and the eyes. In summary, there are two main categories: abnormal eye movements, where there are also impaired smooth pursuits and limited exploratory eye movements. And second, retinopathies, so wider retinal venules, RNFL thinning, and also reduction in macular volume. Lastly, increased perception of brightness and color intensity, which leads to decreased contrast sensitivity. There are also studies that found correlations between schizophrenia and other eye diseases. And this has not been extensively studied either, but schizophrenia is associated with lens opacities and cataracts. And in the front of the eye, there can be pigmentation in the cornea. And the second point is the relations with strabismus. Children with strabismus, which is a misalignment of the eyes, they can develop schizophrenia later. And also those with schizophrenia are also at a higher risk of developing strabismus. Overall, the link between the eyes and schizophrenia is quite promising. When the research becomes more extensive and we get to characterize these general findings more and more, this might be a way to detect and diagnose and treat earlier some of the psychiatric disease, including schizophrenia. There is a saying that there is an expression that says the eye is a window to the soul, and that might be quite literal if you look at the series of studies. So specifically, ophthalmic findings can be used as biomarkers. The unique eye movements, the diminished visual acuity while other sensory functions are intact, widened retinal venues, of course, thinning of the RNFL, and abnormal ERG waveforms, among others. These are quite a characteristic finding according to the studies, and they can be characterized in a more specific manner in the future. This is a summary chart of everything we talked about in this presentation. I hope you find this helpful. And lastly, here is the reference of all the resources that we've used to put this presentation together. Thank you for watching.